Somebody who does diagnostic evaluations of individuals with autism, when I give a diagnosis to a family, those families can sometimes be paralyzed. They look like a deer in the headlights because they really don't know what to do. They can feel devastated, and even some people get depressed. And as a provider, it's important for me to first stop them and say, yes, this is a very challenging diagnosis for your child, but it didn't actually change your child. Your child is the same child before they walked into my office, and they'll be the same child after they leave my office. The key now is that we get your child the kinds of things that they need to develop appropriately. And the things that they need are dependent upon your child. So if the child is high functioning, I begin to talk to the parent about what they need in terms of social skill development or social thinking development. If the child's lower functioning, I talk to them about how they might need a more intensive behaviorally based approach, whether it be delivered in the home or at some other place like a school or their own public school district, and exactly what that type of treatment needs to look like. Many parents will tell me that yes, they did feel paralyzed, but by being able to walk them through that process, and sometimes not just in one session, but actually following up with them and helping them down the road to navigate the array of services and to find resources for them or people that can help them to make sure that the services are in place, like paying for those services. So that conversation is challenging, but once you point parents and caregivers in the direction of helping their child and getting their child what they need, they can become unstuck or unparalyzed, and they can actually begin to see that their child has a future, and that future can be bright for their child, and that if we do the things that are needed, that their child can grow and develop and develop into the kind of functional adult that many parents dream of their children being.